Welcome to It's Getting Better All the Time Mental Health Outreach with your host, Sister A. Legree. It's Getting Better All the Time Mental Health Outreach, providing information and support while encouraging hope and faith. You can log on to our website at igbattmho.org, and you can email us at support@igbattmho.org, or our regular email igbatt1@aol.com. It's Getting Better All the Time Mental Health Outreach provides information and support while encouraging hope and faith to individuals who are living with the symptoms of a severe mental illness, regular mental illness, or other negative life situations. Again, you can find out more about us by logging on to our website at igbattmho.org or igbatt.com. And when you do, please leave a message. Give us feedback. If you have any questions, please do so. Today I wanted to spend some time talking about medications. I titled this Medications and SMI, or Severe Mental Illness, but we're going to talk about medications in general. First of all, let me say I'm a clinical social worker, not a psychiatrist who prescribes medications, or a medical doctor, but I have been doing this for a long time. And I want to just share some observations, and I'm actually going to be using some information from the NIMH.gov, and I encourage you that when you're looking for information about mental health, one of the things you'll see when you go onto our website, most of the information there, I would say 95%, if it's not something that we wrote, comes from a government website or something, an organization that I know is reputable, because there are a lot of information out there. There are a lot of things that's being said out there that may or may not be true. But I know when you're looking at from the NIMH.gov, for example, you're looking at information here is peer reviewed, and it's something that you can pretty much trust. So again, this is where I'm going to be. I'm coming from their little handout, which is mental health medications, and I'm going to be talking in general. So first of all, medications. What medications, when you first, let's say, seek out mental health treatment, okay? One of the first things that should happen is that an assessment should be done. An assessment, when we talk about mental health treatment, doesn't necessarily initially include, a height, weight, physical, blood, doctors taking blood and all that stuff initially. Sometimes the assessment will start with a period where you sit down with a clinician, whoever that person is. They ask you questions about your life, your history, what's going on, and then they go from there. So one of the questions that comes up, people will say, well, why are you asking me all these questions about my life, and what happened 50 years ago? And the reason why we ask those questions is we're trying to get to know you. We're trying to assist you in getting you to better know you. So there's some of these questions that we're asking helps to form a pattern. It helps us to helps you to see, to understand how things relate to, how this relates to this and this relates to this, and just have a better understanding. It also helps us to clarify the diagnosis. So for example, you may come in and say, I feel like, I'm depressed, and you may be depressed at that time, and you just want to talk about your depression, and that's fine, but we're also asking questions about, other things that have happened. Because many times when you go through a person's life, or you go through your life, you realize that you have a history of depression. This started years ago, but you also may notice that in addition to the depression, you also had periods where you were feeling, really anxious as well. Periods to the point where your anxiety caused you not to sleep or caused you to spend more money. So we're asking all these questions so we can form a better picture, because unlike other mental health or other diagnosis, mental health diagnosis, there is no test. There is no physical test. There's no blood test per se. So a lot of how we get the diagnosis is from understanding you. It's from asking the questions. It's from understanding how you relate to the world. So yeah, it is a lot of questions. There is a lot of paperwork, because we're trying to, like I said, trying to understand you, and also at the same time trying to help you to understand yourself, because there's some things that are happening to you, you may not realize how they fit into your life now. Many times, and I think I've said this many times, is that you look at many of us, many young people in particular, let's say 20, 22, and they start having difficulties, and the family member will say, they were fine until they went away to college. They were fine until they joined the military. They were fine until they got with these particular friends. But when you look at the history, you see that they were never really fine. They were kind of like always on that edge, right? We talked about the stress vulnerability model, where a person can be vulnerable to certain diseases, to certain illnesses, and they'll be fine. But it's the stress. But if stress, something changes in their life, will kind of push them over the edge, if I can say it like that. So, but when you go back and look in the history, you realize that this person kind of has always struggled, even in junior high school. They've always had difficulty staying away, concentrating. They may have always had challenges sitting still. They may have always had, problems interacting with other people. So you see it. So as and as they got older, they didn't get help, they just kind of dealt with it. And a lot of times with families, because we're used to the person, we just get used to the certain behaviors. And again, it's not until they go away to a new environment that you start seeing the different changes and they start having challenges. So that's just one example of asking questions. I know many people, when we finally sit down, or they finally sit down with someone and you start doing an assessment and you start asking questions, especially around substance use, we begin to realize that the substance use that they're using drugs now was just a mask, was just a smokescreen. This was something that they started when they were junior high school, again high school, in order to cover up their other feelings that they were having. So they were always having feelings, whether it was depression or anxiety. They may not have felt like they were thinking correctly, so to speak. So they just started using drugs, because what happens is alcohol, other drugs, cocaine, marijuana, all these types of drugs, they do help your mood. They do help to calm you down. They do help to help you feel better. So once a person discovers that, they start using it. The problem with it is when you start using these types of drugs at a young age, you build up a tolerance for it, meaning the more you use, the more you want to continue to use, and then now you have a full-grown problem, so to speak. Many of the people who are in jail or in prison, many of the people who are having challenges later in life, were people who, if you look at their history, see that they had challenges early on, but they never got the help that they needed. And if they would have got the proper help, then they would have had less challenges. Okay? So again, what happens when you first go in, or what should happen, especially if we're talking about outpatient, they're going to ask you a whole bunch of questions, right, to find out what's going on with you. At that particular time, if you come in through, let's say, the emergency room or through a psychiatric facility, same thing, they're going to ask you questions. The only difference is that if you're in an emergency room or in a psych center, they're also more than likely will get some type of labs. The doctor will draw, whether to see what's going on with you. He or she may draw some kind of labs. In an outpatient mental health clinic, we don't draw labs like that per se, unless it's something, an outpatient mental health clinic that's connected to a primary care doctor or has someone right next door. But normally when you come into an outpatient clinic for the first time, it's going to be a sit down asking a series of questions, trying to figure out what's going on with you now, how long has this been going on, has anything like this happened to you before, if it did, what were the strategies that you used before. We asked about maybe family members. Again, the reason why we asked about family members, we're looking at genetic history. There are some disorders that have a genetic component. So that's the reason why we're asking that question. Again, it helps us to understand you. Because remember, you just walked into the clinic. You've been dealing with whatever you've been dealing with all your life. We just met you. So we're trying to help you to understand by asking questions and trying to form a picture of who you are. Okay? So what happens is in an outpatient clinic, you will, more than likely first sit down and talk to someone who does the intake, which is asking a whole bunch of questions. So when you go in for an intake for the first time, please, you want to be patient, because it's a process, right? Then, depending on the clinic, you'll see the psychiatrist. You may see the psychiatrist the same day, or you may see the psychiatrist later on. But at some point, you'll see the psychiatrist, or in some clinics, you may have an APRN, a psychiatric nurse, who is an advanced an advanced nurse. So who can prescribe medications. So you sit down with the prescriber, the psychiatrist, and again, he or she may ask you some of the same questions, but many times it's not as in detail as the person who did the intake, because the doctor has the intake and he or she is able to look at that. So he or she is going to ask certain questions to kind of, again, to help formulate the diagnosis, and if appropriate, they'll prescribe medications at that time. Now, something else I wanted to make about that, but it'll come back to me. When you're sitting down, with the psychiatrist, right, for the first time, they ask you those questions. They'll probably, if they prescribe medication, they'll probably give you a prescription. You can go to your pharmacist to get it filled, or if they're able to fill it there. And then you'll see the psychiatrist on a regular basis. Regular basis could be for the first time. If he or she is giving you medications for the first time, he or she may want to see you, let's say maybe next week, or in 2 weeks, or in a month. Definitely monthly, so at least for a while. But each time you see the psychiatrist, they're going to ask certain questions, and it may, I'm sorry, I'm going to want to make sure I turn my phone off here. And the questions that they ask may seem redundant, but you have to keep in mind, they don't see you that often. If you are receiving therapy from that particular clinic, or if you're receiving some other types of supports, and clinics vary, how they're set up, and if you're receiving some other type of support from that clinic, you may see the therapist or the case manager, or whatever that it's called in your clinic, more often than you see the psychiatrist. You may see your therapist weekly, or your case manager weekly, or bi-weekly, where you might only see the psychiatrist once a month, or you may see he or she every 3 months. It depends depending on the medication. So they're going to ask the same question. So again, I point this out because some people get irritated. He just asks me the same questions over and over again. Yeah, he's going to ask you the same questions over again, because that's like a screen. How are you feeling today? Any thoughts of harming yourself, of killing yourself, of killing others? Those are the questions, basic questions that a good psychiatrist or APRN is going to ask every time they see you. Right? They're going to ask about how you feeling, any issues related to self-harm or self-harm of others. They're going to ask those questions, right? Also, you want to make sure that when you see the psychiatrist or the APRN, the prescriber, you want to talk, right? Many times people will say he or she never really talked to me. When they ask you how you're doing, they're asking you how you're doing related to why you're there. It's not how you're doing related to, my Pittsburgh Steelers didn't win and blah, blah, blah. You can go on and on and on about that, but you want to make sure that you're talking. This is your time, okay, about how you're doing physically, right? How are you sleeping? How are the medications going? You're doing with the medications. Any challenges with the medications? Any questions that you may have, okay? Because what happens in many clinics, especially when you're talking about community clinics, right? The psychiatrists, you don't have a whole lot of psychiatrists. You may have one psychiatrist for several hundred people. So that psychiatrist many times is not doing therapy. He or she is not doing counseling. He or she is not sitting down with you for an hour every time or 30 minutes every time, right? They may be only sitting down with you for 15 minutes at the most. At least 15 minutes. They're sitting down with you. At the most. So during that 15 minutes, if there's something that you need, if you have a question, that is the time. You're talking to the expert in medications, so it doesn't make sense for you to be in their presence to leave and have questions. So you want to talk to the psychiatrist, even if it's not anything related to your mental health. You want to talk to them so he or she can direct you. Because again, it moves pretty quickly. If they ask you those questions and you don't have anything to say, or everything is fine, how you doing with the medications, any thoughts of self-harm or harming others, no. They say, anything else? No, I don't have anything else. Okay, well, thank you, have a nice day. And then you walk out and say, hey, that was only 10 minutes. I had to wait for 30 minutes to see him or her. Well, that was your time to talk. What did you want to talk about? So it's a good idea to write your questions down. Right, to write your questions down, so that way when you go in to see the doctor, you can have your questions. You know what you want to ask. Okay? So keep that in mind. But going back to medications, Medications, and I'm reading from the handout here. You can get this at nimh.nih.gov, and I will post this on our website. Medications can play a role in treating several mental disorders and conditions. Treatment may also include psychotherapy or talk therapy. And it goes on to say that in some cases a person may only need talk therapy, and that's important to know. So everyone doesn't have to take medication. Sometimes just talking to someone, sometimes just talking to your pastor, sometimes just talking to a friend can help you to kind of talk out some things. Talk out some things. So not everyone will need this, okay? But some will. So if you're one of these people that need to take medications, then you need to take your medications. Now, as we continually go on here, what you want to do when talking about medications are broken down to different classes. There's some medications that specifically for antidepressant. There are some medications that treat antipsychotic medications. There's some medications for anxiety that specifically, and then there are some medications that can be used for other things as well. But again, this is something that when you sit down with your prescriber, with the doctor, these are questions that you can ask. But one of the things I do want to say, because what people tend to think, is that these medications are not, they don't make you, someone said, I don't want to take medications because they make me lose my thought or lose my mind or I can't remember stuff. Here's the thing, these medications are not designed to necessarily numb the pain and that you're a zombie. The medications get you to the point where it kind of quiets the symptoms so that you're able to think more clearly and that you're able to do the things that you need to do. It's not a magic pill that takes away all your challenges and all your problems. I think you still have to do life. Life, bad things happen to us all, and we have to learn better ways to kind of deal with it if we're going to be the person that we want to be in life, okay? I don't get into, fighting people to help. If you don't want to be better, you want to sit with your pain, then that's okay. All right, we're not here to fight about that. But I'm telling you that for medications, some people who take medications, their lives are much better because they're taking medications. There are some people who, because they're taking medications, they're able to go on to college. They're able to have a family. They're able to do it without functioning better. If my arm was broken and I needed a cast, right? Like really broken, and I needed a cast, and I'm walking around without the cast, but I'm walking around in pain, my quality of life is going to be poor. When I sit down, I'm going to, grimace in pain. I'm not going to be able to sleep properly. I'm not going to be able to interact with others because I'm focused on the pain. I'm focused on managing the pain. The medications can come alongside you and help you to manage the pain. Again, the pain of what? The pain of depression, the pain of anxiety, the pain of not sleeping, the pain of having thoughts just whirling around in your head, the pain of tearfulness, the pain of just being anxious, the pain of racing thoughts. So all of these things are pain because here's the thing. If you're so focused on trying to manage your symptoms, right? You know there's something going on with you, or maybe you at this point you don't, but there's something going on with you. You are challenge, you're putting weight on yourself unnecessarily when there's help there available for you. And those of you, again, who follow this broadcast, who follow us, we say providing information and support while encouraging hope and faith. When we talk about from a faith side, think about it like God has given us all things that's pertaining to life, to health and godliness, to life and godliness, right? His desire for us to be able to not just live a life so we can live a life for our own selves, but in order to bring Him glory. So we bring Him glory when we are able to perform in the way that we were originally designed. We bring Him glory when we are able to live, to operate into what He has called us to be. If He's called you to be a doctor, if He's called you to be a cook, if he's called, or a chef, if he's called you to be a social worker, whatever he's designed for you to be initially, you bring him glory when you're able to operate in that, whatever he's called you to be. That's where he gets the glory, because from through that, his glory is seen. But what happens is the enemy tries to kill, steal, and destroy. What is the enemy? Thoughts, feelings, and behaviors that are contrary to the Word of God. That are contrary to the Word of God that says that you can make it, that you can do it, that you can be all that He calls you to be. So what other kind of thoughts that come? Thoughts that tell you that you don't need to take medications. And when you do. Thoughts that tell you that you don't need to get help, that you can struggle on your own. Struggle, you don't get a badge or an award because you're struggling. Oh, I'm struggling. I can do this. I can do this. No, Jesus Christ already hung on the cross. He already rose from the dead, and He gave us gifts. And some of the gifts He gave us is how to better take care of these bodies. You're not, what are you saying, being untrue to the Bible or untrue to Him, or you're not hurting His feelings if you have to go see a doctor. We'll go see a doctor and take medications if we have a cold, if we have other things, menstrual cramps, if we have other things going on with us. But for some reason, when it gets down to mental health, we feel like we got to do it on our own. It's a taboo topic. We don't want to take medications, and that's not you don't have to feel that way, right? But again, the point I was making is that when you walk around with a broken arm, I'm struggling, right? All I'm focusing on is on my broken arm. It's hard to focus when you're in pain. It's hard to focus on starting a business or in being a better version of you, being a better version of the you that God has called you to be. Not just a better version of you, because we don't know what that is, but you want to be a better version of what God has called you to be, right? It's hard to do that when you're focusing on your pain. And that's what happens when you are dealing with symptoms, untreated mental health symptoms, because you are so focused on what's going on inside, you can't focus on what's going on externally. It's hard. It's hard to focus. It's hard to focus on graduating high school when you have thoughts running around in your head. It's hard to focus on getting a degree when you can't sit still. Every 5 minutes you're up pacing the floor. It's hard to stay awake in order to, let's say, to become a doctor if you can't concentrate, right? So again, physical symptoms. When we talk about mental health illnesses, it's not just, mental, it's also not psychological, but physical as well. When you have all of these symptoms going around in your head, floating in your head, or impacting you, it's hard to concentrate, right? So the medications can help to do that. People will say, again, I don't want to feel like a drug addict. These mental health medications are not the same as cocaine. They're not the same as crack. They're not the same as marijuana. They're not the same as all those other types of drugs that you take. These are medications, right? Some people may have to take them for a little while, and and some people may have to take them for a long period of time. Some people may have to take them for forever. Just like, think about hypertension medications or other medications that you may have to take for a while, right? So let's talk about antidepressant medications. Antidepressants are medications commonly used to treat depression. Antidepressants are also used for other health conditions such as anxiety, pain, and insomnia. So like I was saying before, sometimes the medications can be used for other things. Okay? It also says, although antidepressants are not FDA approved specifically to treat ADHD, antidepressants are sometimes used to do so. Okay? And then there are different types of medications that antidepressant medications, right? So again, your doctor can talk to you about the different types of antidepressant medications if you need to take it. One thing about antidepressant medications, let me say here, antidepressant medications, let me make sure I still got it. Antidepressant medications do not work as fast as some of the other ones. So you will not, take the antidepressant medication at 8 o'clock and feel good in an hour. It takes a little while, right? So that's why you have to stick with the medications. You want to be, make sure you're talking to your doctor, letting them know what's going on with your medications, and that you're also continuing to do the other work. Because it's just not taking medications. It's also kind of taking a look at your thoughts, feelings, and behaviors. It's also taking a look at your habits. It's also taking a look at other things that's going on with you. Right? So you want to kind of continue to do that as well. So you have medications, right? All antidepressant medications work about as well as each other to improve symptoms. So there's different types of antidepressant medications, and they all pretty much kind of work pretty well. For reasons not yet well understood, some people respond better to some antidepressant medications than others. So again, what they're saying here is while all of the medications, antidepressant medications, kind of work similarly, kind of the same way, there's no research that said this one works better than the other, but we do know certain people respond to different medications differently. So again, that's why you need to talk with your doctor. Okay? Therefore, it is important to know that some people may not feel better with the first medications they try and may need to try another one. Oh, and again, let me stop here. People are saying, so these doctors are experimenting. They got me trying different types of medications and blah, 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 blah. And again, that is, one, they're not experimenting, but two, sometimes you do have to try different medications in order to make sure you get the right one. Because again, you're a unique person. You're coming with different symptoms. You got other things going on, a lot of things going on with you. So the doctor may have to try different medications. For a younger person or a person with no health concerns, who is in shape, they may work better with this type of medications. A person who is taking other types of medications, your doctor may have to try other type of medications. So it just varies. It varies with the individual. It varies with your own individual profile. Because one of the questions that the doctor will ask, and if they don't ask, you want to make sure they do, they're going to ask, what other medications are you taking? They're asking these questions so they can see, what are there any, are there any challenges? Okay, if you're taking this a blood thinner, then this particular medication may not work well because you can't take this medication if you're taking a blood thinner. So you want to try to remember all the medication that you're taking, and you want to be honest with the doctor. Also, if you are doing other things, I know in a lot of places marijuana is illegal, or it has been it's legal now, right? So people are using marijuana, but you may think it's fine. But when we talk about certain medications, it's not fine. Certain medications don't go well with marijuana, right? So you want to talk to the doctor about it. The doctor needs to know that. Even if you get a prescription from some doctor who says that you need, you should take marijuana or smoke marijuana, whatever the case is, it still can impact your other medications. Your doctor needs to know about it. Also, if you're taking herbal medications or herbal remedies, the doctor still needs to know, because some of these things that we're taking, these medications, everything doesn't mix well. So again, I just wanted to point that out, because some of the objections that I hear to medications is just that, these doctors don't know, they're experimenting on me, this medication is not working, I don't like having to, they're trying another medication on me, I don't like this, Again, this is part of the process, but I'm telling you, if you can get the medication right, then things will, you'll see some type of improvement. Once you start taking antidepressants, it is important not to stop taking them without the help of a doctor. So once you start, you want to be honest with the doctor and say, I don't like taking these medications. Or you may have been taking them for a while and you start feeling better, which people do this all the time and it's unfortunate. Now, you start taking the medications, you start feeling better, now you don't think you need to take the medications. And that's not always a good thing to do. But again, you want to have a conversation with the doctor, because that way you can come off the medications safely, and you can talk about some other options. Sometimes people taking antidepressants feel better. Like I said, stop taking the medication too soon and the depression may return. When it's time to stop or you feel like you don't want to take the medication, talk to the doctor. Also, don't lie to the doctor, right? If you don't want to take the medications, then say you don't want to take the medications, right? Have a conversation about why you do not want to take medication, okay? Don't make the doctor think you're taking it and then you're not. And oh yeah, I'm taking the medication, because you're not, you're only hurting yourself. And we can tell sometimes that you're not taking it, so don't do that. People will say, I don't want to get addicted or hooked on these medications. You don't get addicted or hooked on antidepressant medications, okay? It's not the same, you go on like withdrawals and like cocaine and stuff like that. Now, there's one particular drug with the anti-anxiety medications. The anti-anxiety medication, well, I'll wait till I get to that. But those you have to be careful with. Are there side effects? There are side effects to everything. There are side effects to, drinking too many Pepsis, drinking too many sodas. There are side effects. With all that sugar, one of the side effects is weight gain, right? So there can be side effects to the medication, but some people don't have them. Some people have no side effects. Some people have one or two. Some people have many side effects. That's why you need to talk to the doctor. And again, a lot of the side effects, it really depends on you as an individual, as far as your individual makeup and what other type of medication that you're taking, okay? One of the reasons why people, again, especially men in particular, who don't like taking the medications, mental health medications, because it messes with their sex drive, okay? And that's a very real concern. All of these, your concerns are real, but again, have the conversation with the doctor. You don't need to just stop. Have the conversations with the doctor, okay? Anti-anxiety medications. Anti-anxiety medications are, let me read it here. Anti-anxiety medications help reduce the symptoms of anxiety, such as panic attacks or extreme fear and worry. The most common ones are benzodiazepines, which is for general anxiety disorders. Let me go down here. Okay. Anti-anxiety medications are effective in relieving anxiety and take effect more quickly than antidepressant medications, often prescribed for anxiety. However, let me read this again. Anti-anxiety medications are effective in relieving anxiety and take effect more quickly than the antidepressant medications, often prescribed. However, people can build up a tolerance to the medications. Anti-anxiety medication, when I talked about before, how these are not like street drugs. Anti-anxiety medications have to be monitored by the doctor, because out of all the medications, anti-anxiety disorders medications can cause people to build up a tolerance, right? And what tolerance is, you wanting more each time. Anti-anxiety medications, usually most doctors will only prescribe them for a short period of time. Now, I know some people who are on anti-anxiety medication for a longer period of time, but they're usually people who have been under the care of their doctor for a while, and they're usually taking other medications as well. But anti-anxiety medications, I can tell you, are the ones that we have the most challenges with people as far as medications, because people build up a tolerance for them, and when they don't get them, it can cause challenges. So anti-anxiety medications, usually you're not going to be on those for a long period of time, okay? Again, they all have side effects, but everybody doesn't experience the side effects, okay? Antipsychotic medications are primarily used to manage psychosis. And what we said before, psychosis just means out of touch with reality. Psychosis means a person is out of touch with reality. Psychotic, they're out of touch with reality. There are different illnesses in which a person can exhibit psychosis. Schizophrenia is one of them. We talked about depression can be one of them. We talked about substance use, certain drugs. A person can be out of touch with reality. Okay. Psychosis is used to describe conditions that affect the mind where there has been some loss of contact with reality, like I said. It can be a symptom of a physical condition, such as drug abuse or a mental disorder, such as schizophrenia, bipolar, or psychotic depression, like I said. Antipsychotic medication can also be used to treat other illnesses as well. ADHD, general anxiety disorder, eating disorder, PTSD. Antipsychotic medications do not cure these conditions. They are used to help relieve symptoms and improve quality of life. And that's it. If we talk about relieving the symptoms to improve the quality of life, so you can have a better quality of life, right? It doesn't take away from the fact that you still need to do other things. You still need to eat right. You still need to have friends. You still need to pray. You still need to fast. It doesn't take the place, right, of the Holy Spirit. It doesn't take the place of church or any of those. It doesn't take the place of anything. All it does, it allows you to have a better quality of life. It gets you to the point where you are able to read the Word of God better. It gets you to the point where you're able to enjoy your family, where you don't feel like, staying inside all of the time, because as we said before, when we talk about depression, for example, depression hurts. It hurts physically. When you're depressed, you don't feel like going outside. The things that you used to do, you don't like doing anymore. You used to like playing with your children. You don't really like playing with them anymore. When you're anxious, you're dealing with anxiety. Your world becomes smaller, right? Because when you're dealing with anxiety, you start cutting things off, and you don't even realize it. Let's say, for example, when you're dealing with anxiety, let's say you have an anxiety about going outside. So now you limit the amount of time you go outside. You go out maybe once a month, and then once a month turns into once every 3 months, and then once every 6 months. Until now you only go out maybe 1 to 2 times a year. And you're just in the house ordering DoorDash all the time. You're in the house, everything is delivered. Everything is delivered. You never go out. And then it also causes depression, because now you look at your life. You're in the house all the time. You may be on social media, but you don't really have anybody to engage with. You're not going out. People can start feeling like a quote-unquote failure. People can start feeling more depressed. So you can't do the things that you used to do. You can't enjoy life, because life has become so small for you. There's a big world out there, but because of the untreated anxiety, because of the symptoms of anxiety that are overtaking you, you can't enjoy the world because you don't go out. You don't feel like going out. You're afraid to go out. Your symptoms are such that it doesn't allow you to go out and enjoy life. Remember, the enemy comes to steal, kill, and destroy. He is killing and stealing and destroying your potential through your untreated symptoms. Okay? So I just want to point that out. They are used to help relieve symptoms, not to improve the quality of life. Your quality of life, improving your quality of life, or the quality of life that you have, is dependent upon you. Right? We have choices. One of the things that God has done, He has given us the ability to choose. We can choose things that are positive, or we can choose things that are negative. Yes, we may have had things that have been done to us. We may have been abused. We may have been taken advantage of in whatever way. And that's, it may make us feel like, okay, because this person did this to me, I don't have a choice. No, you do have a choice, right? We do have choices. We can make some decisions. It's not hopeless. And see, that's what the enemy would try to get us to think, but put us in this tunnel vision where we begin to think that we have no choices, we have no options, that the life I have is the only life that I can have, that God did this to me, that God doesn't love me, because God allowed this to happen to me, I don't care about God anymore. And we have this tunnel vision, right? Not realizing that there are consequences for tunnel vision. And the consequences for tunnel vision is even more tunnel vision. The consequences for tunnel vision, where you thought, I can't do this, and this happened to me, and and all of those things are true. But you got to be able to get to the point where, yeah, this has happened to me, but I'm not going to let these things that happened to me, that people did, put me or put me in a situation where I can't fulfill the God-given destiny and I can't live my life to the fullest. I'm not going to go around walking in fear, living in pain. Pain of being hurt again. Pain of, things are not working out. Pain, does make me think that I'm a loser, that life is not worth living. I'm not going to do that. I'm going to come to the point and realizing that these things happen to me. I'm going to be dealing with them. I'm going to work through them day by day. I'm going to relive the pain, because sometimes we got to relive the pain, deal with it, and then keep going. I'm going to relive the pain. Remember what happened to me, because one of the things people try to do is forget it. No, you don't forget it. You relive it. You bring it up. Okay, this is what happened to me. You talk about it, you deal with it, and you keep moving. Oh, that sounds easy. No one said anything about being easy. Okay, again, you don't want to make excuses, because again, we don't want to get to the point where you fight a person or you get angry at an individual because they're telling you something that could potentially help you. Some of us, we are so invested. Okay? We are so invested in keeping and holding on to our hurts. We're so invested in holding on to our pain. You don't know what happened to me. You don't know how they treated me. You don't know, all of these things and what happened. Yeah, well, my son died. My daughter died. I was abused. I was sexually abused. All of these are bad things that happen to us. Unfortunately, it happened when no one is saying that it didn't, and no one is not saying that you have a right to feel how you feel. But you want to look at what is happening. What as you're holding on to this, and as you're fighting for your right to hold on to your pain, what is it doing to you? Okay, what does it do? How is it helping you? Is it moving you further? If holding on to your pain and defending your right to hold on to your pain, defending your right to make it, I don't want to say excuses, but to explain, okay, this is the way I am. This is why I am the way I am, because a narcissist did this to me. That's the biggest word now. Everyone, and it's interesting when you look at the DSM-5, the number of narcissists, or the number of people in the world who really who meet that diagnosis is really not as much as people seem to think it is, because everybody's a narcissist. But again, you holding on to your pain, and you're talking about what the narcissist did to you, and all of this type of stuff, that's fine, but that narcissist is going on with their life. You have whole YouTube channels, and you have whole Facebook channels, and you have whole books talking about the narcissist and what they did to you, and you're holding on to that. You want to, as an excuse, right? As a way to say, okay, I'm this way because this person did this to me. And I understand that, I get it, we're all sympathetic to it. But ask yourself this question: what is it doing for me? Is it making your life better? If it's making your life better, then fine. then fine. Then that's good for you. As long as it's drawing you closer to where you want to be in life, as long as it's drawing you closer to moving forward in the destiny that God has for you, as long as it's making you a better person, as long as it's getting, you're not up at night worrying about it, you're sleeping better, you're eating better, you're living your life, you're laughing, you're smiling, you're living authentically, you're emotionally healthy, you're more emotionally healthy than you were before, and if holding on to that pain is doing that for you, then that's fine. But for the rest of you, for the rest of us, where it's not working out that way for you, you want to begin to take a look at, okay, yeah, these things have happened to me, but what can I do? Okay, why am I triggered every time? Why is it that when someone says, oh, it's just a wonderful day outside, I automatically go back to my pain? Yeah, it's a wonderful day, but you don't know. Yes, it's easy for you to say that, but you haven't dealt with the trauma that I've dealt with. Okay? Why do you feel a need to say that? The person just said it was a nice day outside. That's all they said. Okay? So the question is, you want to find, okay, why do you feel, and when I mean why in the sense, not why that you shouldn't ask that question or shouldn't feel that way. I'm asking why. Why are you feeling that way? What is going on with you? What is in your soul, that's in your spirit, that needs to be dealt with? What is still not undone? What is still not untouched? Things need, like I said, have to come up to the surface. Come up to the surface and talked about and discussed and relived, and we kind of process it. What is it that's still there? Okay, is it resentment? Is it anger that you're still dealing with? Are you still dealing with, is it pride? Sometimes we can get prideful about holding on to our pain and we don't even realize it. What is it? It's a simple statement. I have something here, says, watch your thoughts for they become words, right? You can't read it, but it's over here. It's over here. You can't read it. Okay? Or just something here, because maybe you can read this. It says, what we think we shall become, and it's from Buddha. Even something simple like that. People are triggered and they'll say, well, what do you mean by that? No, I really don't agree with that statement because my grandmother. I don't agree with that statement because this happened to me. I don't agree with that statement. That's fine that you don't agree with the statement. But why are you triggered by it? Again, what is going on with you? Okay, why are you asking? Again, what's going on with you really? And I'm not asking what's going on with you just so you can feel defensive. I'm asking that question so you can find out what's going on with you. Why do you feel a certain way? Why is it that when someone else is happy, you're upset? Why is it that when someone else says, "Oh, I have a wonderful marriage," we automatically have to talk about your bad marriage? No one said anything about your bad marriage. Why can't you be happy for this other person? Why? That's all I'm saying. Okay. This has nothing to do with medication. So let me get back to my topic. But I really kind of wanted to share that, okay? So we talk about antipsychotic medications. They're used to help relieve symptoms and improve quality of life. And I ramble on like that because from doing this for such a long period of time, I hear stuff like this all the time. No medications, and people just got a lot of different viewpoints. But I'm telling you, medications, if you need them, work. They help. They can help you to breathe, and breathe meaning just emotionally feel better. They can help you to emotionally, just to think, okay? They can get you out of the fog where you can think better about the decisions that you have to make. Taking medications is not going to make the decisions for you. Taking medications is not going to turn your life all cheery and rosy. It's not going to make all your pain and all the negative things in your life go away. It's not going to cause you to all of the bad thoughts. It's not going to take away all the thoughts that cause you to worry. It's going to get you to the point where you're able to have the strength, a better strength emotionally and psychologically, where you can begin to challenge those thoughts and you can begin to come up with strategies to deal with those thoughts. It's going to cause you to be able to focus more on the Word of God. Right? It's going to cause you to get to the point where you can read the Word of God more, and you can pray more, and you can, fast more without having that added baggage. Like I said, having to walk around with a broken arm. Yeah, I can walk around with a broken arm. I don't know how long you can walk around like that for. But let's just say, for the sake of argument, since I'm not a medical doctor, you can walk around with a broken arm for a while. Okay, let's just say a while, meaning for a week. Okay, but at some point, and the entire time I'm walking around with a broken arm, I'm able to eat, I'm able to get up, I'm able to talk to people, I'm able to walk around, I'm able to go to the store, I'm able to do all these type of stuff, but I'm doing it in pain. I'm doing it grimacing. I'm doing it every time somebody says something, I tense up. I'm doing it, but it's not the best version of what God has called me to be, because I have a broken arm and I'm in pain. Every time I sit down, I'm like, oh, wow, you okay? No, I'm okay. I got to deal with this broken arm. I get up, oh, shoot. Can you move this over for me? And I'm trying to drive. What's wrong? Oh, I think I broke my arm. That sounds kind of, why are you walking around with a broken arm, Arnetta? Why don't you get it fixed? I'm saying to you, why are you walking around with all these things in your heart, in your spirit? Why don't you get it fixed? Why are you walking around? You don't have to walk around try to manage anxiety and manage racing thoughts, manage these all thoughts going in through your head. You know, you're thinking thoughts, you don't even know why you're thinking them. Right? You don't have to deal with the depression that's gotten so bad that when you go home on Friday, you know, you make it through the week, but when you get home on Friday, you get into your house, you take off your clothes, maybe you're in bed the entire time, and the entire time you're in bed, you're crying. In the bed, or if you're not crying, you're thinking about all these negative things that's going on in your life, and you're anxious and you're worried, or you're either sleeping too much, sleeping too little. You know, you're dealing with all these things, and you're getting up Monday morning, struggling to get up Monday morning to get it to work, and no one knows what you went through. No one knows the things, the challenges that you went through. No one knows how close you came to killing yourself last night. No one knows how close you came to, you know, walking in front of a bus, you know, or jumping off your balcony. Nobody knows how close you were to all these different thoughts. I'm saying that you don't necessarily have to live that way. You have the option. You have options. God has given us all things pertaining unto life and godliness. And life and godliness, one of the things that's part of that is if you need to take medications, then you need to take medications. You need to talk to somebody, talk to someone. You take medications for everything else. Okay? And don't substitute. Don't substitute marijuana or crack or any other type of drugs or these what do you call these herbal remedies. I don't have anything against them, but don't substitute it. You want to see someone, talk to the doctor, hey, this is what's going on, because again, you may not know all of what's going on with you. I'm sorry, I talked about what happens in an outpatient clinic. At some point, that doctor is going to say, I need you to see a primary care doctor. Right? At some point, the psychiatrist is going to say, I need you to see a medical doctor. I need you to get physical. One of the things that we do in our particular clinic, and I think it's a standard, is that we require or strongly encourage everyone to see a primary care doctor and to get a physical and to get lab work at least once a year. Right? But because what happens is, if we can get the doctor and get the lab work, they may be able to see that there's some other things going on with you. Well, you think it may be depression, and it may be something going on with your thyroids, right? So again, having a primary care doctor is critical, is important to all of us, especially if you're dealing with mental health issues. You want to have a primary care doctor if you have a loved one. And you know your loved one, for example, may not be able to articulate their concerns or because of their symptoms with a primary care doctor, you might want to make the appointment and go with them. And you want to make sure that that primary care doctor is doing all of the tests that they're supposed to do. Depending on your age, there are certain, tests that you should have at a certain age. At a certain age, you should have, a mammogram or whatever, A1C3 or whatever the medical terms are, you should have, right? So you want to make sure the doctor is doing that. And especially if you're dealing with someone, a loved one who is dealing with maybe schizophrenia or bipolar or psychotic or one of those types of illnesses, because sometimes when they go by themselves, they don't always get the best type of treatment because of their mental illness. So sometimes the doctor or the nurses don't understand them, or they don't have the time. They can't really be, they're not as patient as they can be. The symptoms are difficult. Again, it's a lot going to it. And we know that individuals who are living with a mental health disorder die much earlier than the general population. They die much earlier than the general population. One is because many times we don't, or they don't, see their primary care doctor. Because think about it. For those of you who are not dealing with a chronic illness like a mental disorder, you don't go to see your primary care doctor like you're supposed to, right? Right? You don't. It's a yearly physical. You don't do it. You don't keep up with it. So if you're not keeping up with it, you can imagine how challenging it could be for someone who is dealing with maybe a psychotic disorder, to remember that they need to see their primary care doctor, right? So, but again, at some point, we all need to see the primary care doctor, and when you do, you want to make sure that he or she, they're doing the blood work, full panel blood work, what doctors are supposed to do. They know what they're supposed to do, but I just wanted to point that out, especially when we're dealing with individuals with psychosis, that sometimes they need a buddy. They need someone to talk for them, but sometimes the doctors won't always know what's hurting them because they may not always be able to tell it appropriately. Okay, how do people respond to antipsychotics? Certain symptoms such as feeling agitated and having hallucinations usually go away within a few days of starting an antipsychotic medications. When you go into, if you have to go into the emergency room, for example, and a person is actively psychotic, there are certain things they call cocktails that a doctor can administer, and with those cocktails you start seeing changes quickly. Initial changes quickly, but there are some other changes that you won't see. It might take about a week or so to really see the full changes. But again, every person works differently. And again, antipsychotic medications do tend to work quicker than antidepressant medications. Again, when we talk about relapse, people stop taking their medications. Some people may have a relapse, and I'll read it, meaning their symptoms come back or get worse. Usually relapses happen when people stop taking their medications or when they only take it sometimes. Some people stop taking the medication because they feel better, or they may feel they don't need it anymore. But you shouldn't do that. You need to take your medications on a regular basis. As I said, some people have to only take medications for a little while. Some people may take them longer, have to take them forever. And then you have mood stabilizers, another form of medications. These are the medications that treat the mood disorders, such as bipolar disorder, and sometimes they may treat depression as well. Mood stabilizers are used primarily to treat bipolar disorder, mood swings associated with other mental disorders, and in some cases to augment the effect of other medications used to treat depression. For example, lithium. A lot of doctors, especially in outpatient facilities, don't really like prescribing lithium unless they have to, because lithium is one of the drugs that you must get a regular blood work. You have to check your blood, okay? Because if a person with bipolar disorder is being treated with lithium, he or she should visit the doctor regularly to check your lithium levels. So you kind of have to do that. So a lot of doctors don't really do lithium. They may do other things, okay? But again,